Hello. Yes, good evening all and welcome to career counseling session. Myself, Dr. Bharath Kumar VD. I am the pharmacology faculty, DBMCI and eGurukul. So I hope the audio and video is clear. And for those who are interested in taking this MD pharmacology, so before I start my session, let me introduce I not only a faculty in DBMCI, I'm a practicing diabetologist and also I'm a member of ethics committee and also I I run some of the small shops which are the pharma companies. Particularly, those are the things what I wanted to communicate to you. I'm a practicing diabetologist. Okay, so everything is fine, I think. Of ethics committee, and also I I run just a minute. Some of the small shops which are pharma companies. Particularly, those are the things what I wanted to communicate to you. Okay, so everything is fine, I think. Ethics committee. Also I run some of the small shops which are pharma companies. Particularly, those are the things what I wanted to communicate to you. Bharath Kumar VD. I'm the pharmacology faculty, DBMCI and eGurukul. So today, yes, we have this career counseling session, and yes, now I think everything is fine. Chinnam, Captain Krishna, Satvik. So now it's fine. So yes, and those who are aspiring to take MD pharmacology, so I have to tell you what are the prospectus of this MD pharmacology, and I'm happy to take all your queries here. So myself, I am the faculty in a medical college, and I also work in DBMCA, and also I run a small shop that is a diabetology clinic. So I have multiple roles to play. I also worked in a pharma company, and I have huge experiences everywhere. So that's why I'm the right person to communicate to you whatever doubts you have with MD pharmacology. So I finished my MD pharmacology around 2013, and when I joined in 2010, I had the same notion what you have right now to join MD pharmacology. Now, so before you get your doubts, let me clarify this MD pharmacology. It's a 3-year course. Wherever you join, it's a 3-year course. And what exactly in MDT pharmacology? Yes. Now, what do you do in 3 years of PG life? In 3 years of PG life, is there any patient exposure? No, we don't have any patient exposure as such unless any of this course, PG course is from a morning 9 to 4 p.m. So later you can start your small clinic or you can go to the hospital and practice. Otherwise, there is no patient exposure unless you do some research. Now remember, research is the one which is going to fetch us more rewards in the future. So try to do more research in the PG life. Next one is In case of PG life, the next thing what you are going to do is research and thesis and dissertation. So that will be done. So it will take around 6 months, you will complete that, but most of the times you will be free. When you enter 9 o'clock up to 4 o'clock, you will have some classes to take. If it depends on what medical college you are joined. If it is only MBBS medical college, not much classes, but if it is attached with a dental or a nursing, then you will have more classes. Otherwise, practically not much. So you will have practically more free time in this period. And do we have animal experiment to do? Do we have animal experiment to do in case of this PG life? Nowadays, the animal experiments are not done in medical colleges because they have been banned now. So what you can do is in the free time, dedicate your free time for research. Now, which colleges are better for MD pharmacology? Now, the better colleges are the colleges which are located in Mumbai. So Mumbai medical colleges are better because the most of the pharma companies are located in Mumbai. Or if you cannot go in Mumbai, either you can choose any metro cities like Bangalore, Chennai, or you can choose Delhi. So whatever the major cities, there you can choose this. Particularly if we can go with the AIMS, that is also better. So Mumbai is better for the exposure to pharma company. Now moving on to the after 3 years, what next option do we have after MD pharmacology? What options do we have after MD pharmacology is a question. Now after that, what we have as an MD pharmacologist is basically in a medical college, or it may be in the pharma industry or in research. Now after you finish that in medical college, in the medical college you will join as a tutor. After 1 year you will be promoted to assistant professor. So the field is already saturated in medical colleges, even though medical colleges are plenty. But once you get a job there, the job is 9 to 4. After that, nothing to worry. You finish your work, go to home, take rest. So if you want work-life balance, this is the one which you can choose, medical college. So do from 9 to 4, then rest. Now the starting salary for a new fresh out will be around 60K, which is comparable to the clinical branches also, same thing. Now once you become assistant professor, from there to become associate and then professor, the promotions are difficult unless you change the medical colleges. If you stay in the same colleges, it's highly difficult. Now what about the pay hikes? Pay hikes are not that much great unless you are in a central institute or central government job. Otherwise, in a state jobs, the pay hikes are not much. Now, most of the MD finished candidates are joining as tutors in the medical college due to lack of job vacancy in medical college. So that is the main thing what happens in a medical college. So you choose according to your choice. 9 to 4 job, no worries. Starting salary will be less and even the increment will not be that much. But you will have free time at 4 o'clock, you can relax. So if money is not a concern and if you don't want to see the patient, that is fine. Second thing what you can do is you can do 94 job and then evening you can start up your small clinic and then start your practice. That can be done. Now, what about pharma industry? Now, pharma industry, we have two important aspects here. One is called medico marketing. So medico marketing mainly is a pharma company. For example, if you want an example of Cipla, Sun Pharma, and AstraZeneca. So those companies will hire doctors, particularly MD pharmacologists, and we need to meet specialist doctors and take their opinion, and we need to conduct CMEs. So all those meetings has to be done. And here, since you will be the main responsible person, there will be a lot of travels in the weekend. So that is one of the important thing you need to keep in mind. So because at the age of 27 to 30 years of age, you will be in the mood of marriage. So consider that. If you are marrying and then traveling, so that will be a difficult thing. But pharmacovigilance is one more job which is affordable in pharma industry. That is a desktop job where you need not travel. It is only you have to sit from 9 to 4 in front of a desktop, that is in the computer, and then do your job. Yes. Now, what are the opportunities? Do we have opportunities after MD pharmacology? Yes, lots of opportunities, good money. The starting salary will be around 1 lakh. Now, increment as you experience the field. For example, recently one of my junior got selected the starting package is around 13 to 15 lakhs per year. Even the clinical branches won't get that. And when you experience for around 6 or 7 years, your package will be around 40 to 50 lakhs per year. 40 to 50 lakhs per year, which even the clinicians cannot earn that much. But when the money is so much, when the company is spending you so much of money, so then they require more of your time. So here increment is also there, and very good increments. And you need to travel a lot during the job. A 9 to 5 job, it's 9 to 5 job, but it may extend like IT people. Suppose you wanted to be an engineer and you supposed you became a doctor and you still want to be an IT person, then join this pharma industry. It's similar to that. And most of the times no time for family, because when you travel it's very difficult to give time to the family when work pressure will be there. That doesn't mean that you have to go away from this pharma industry, because even if you take clinicals, the same thing. You will also have no time to family. You have to practice from morning to evening. You will have patient work pressure, obviously will be there. So if you want more earning, more pressure will be there. So that is obvious. So demand and supply will be there. Now moving on to the next thing, research. What about research field? Should I do MD pharmacology and go for research field? Now research, lots of opportunities are there. And here also the starting salary is not that much compared to pharma industry, around 70k. Research can be done even without MD degree. So with MBBS also you can do research. There is no compulsory that you do MD pharmacology, then MD community medicine, then do research. Now when you do the same thing after 3 years, you will be equivalent. MBBS with 3 years of experience is equivalent to MD pharmacology. So there is nothing change when you get an experience. And research, the growth is very slow. And most of the pharma companies are reluctant to do research in India nowadays because of strict rules. So that's the point. So which medical college did you do MD pharmacology? Satvik Raj, I did it from Bangalore Medical College, which is in the metro city. And that was my college. And college was fine. How was your college? A very good question. College was fine. Same thing, 9 to 4. And remember, in medical colleges, most of the professors won't teach you. You have to learn on your own. So because you have become adult, you have become an MBBS graduate, they will only assist you, and most of the learning should be done by you, because we only have to learn most of the things. You teach so well. Did you join any medical college? So yeah, I'm currently working in a medical college only. So, and in my free time, I'll be doing this coaching and all. Yes, Satvik, I also practice. And I practice diabetology, and I just see for hypertensive patient, dyslipidemia, hypertension, diabetes, which are chronic diseases, and I give them appointments. So I don't make my life hectic so much. For 5 years, I strived hard to get the patients, and now it is appointment basis. So whatever branches you take, you have to strive hard, then only you will excel. So even if you take MD radiology, whatever you take, everywhere you have to strive hard for 4 or 5 years, and after that, it will be easier path for you. Growth in pharmacology is not good kind of static job, company work like glorified medical representative. Yes, that will be there. So that's what. Once, if you want money, you have to leave that that feeling that you are a glorified MR. So most irritating. Yes, it may be, but you have to take care. That's why they pay you. That's why they will pay you, because when you get money, you cannot ask for that. So it all depends on what you want to do. Now I explained to you research. These are the points in research field. Now apart from that, any other opportunities? Yes, you can do private practice. It's obvious. Now many students ask me, sir, should I do MD pharmacology and do private practice? There is no need to waste 3 years of time and then do private practice. You can do with MBBS degree only. So if you are passionate, if you want to do some other thing, don't go for MD pharmacology. And yes, the bright future is with the coaching also. But can I take up coaching? Now it looks fancy, but do you think it will be easier to do coaching and all? There also you have to take class from 9 to night 9 o'clock, and you have to go to various cities, eat various foods. You have to adapt, you have to keep your health well, right? The payment is good, but you have to take care of your health also. You have to travel a lot. Here also, to give time to family will be difficult. But so all those comes with pros and cons. And startups. So you can start up a small pharma companies, and that is fine. you can start up, and you will have a lot of free time when you are in a medical college. You can utilize for many things. Yes, a big Daksh. I worked in pharmaceutical company. Yes, no one nowadays in GSK. Yeah, I understand that. I too worked in a pharma company, and then after that I entered a medical college. Tripti, 24K, what are the options? Should I go for MD pathology versus DNB anesthesiology? Tripti, it depends on your choice, what passion you have. Suppose you are liking to be anesthesiologist, go with that. If you want a pathologist who want to sit in medical college in a lab, and then you decide. So whatever field you choose, guys, it's how you do your efforts and excel in that. No field is going to, suppose you finished off your MD dermatology, MD medicine, or MD radiology, no patient will come and jump and come to you because you have finished recently. There also you have to work for a month, then only you will get a monthly salary. You have to work there also. So whatever branches you take, the slogging will always be there. Sir, which college is better to do PG? KLE, Belgaum, KSIGDE, Yenapoya? Yes. So comparatively on all those things, KLE, Belgaum will be better AB. AB teaching side saturation level, sir. Yes, saturation will always be there. Teaching side, yes, there will be saturation. Now new medical colleges are coming, but until you finish that 3 years, again the saturation point will be reached. So teaching, I don't recommend to join a medical college unless there is a vacancy. That's it. I am in tier 3 city. Can I write MBBS and plain MD to start my practice of doing MD pharmacology? Yes, you can write MBBS MD, and along with that you can do some small courses like diabetology courses will be available. You can do that, and then you can practice as diabetes consultant. No problem. See, basically what you have to treat is mainly in tier 3 cities 3 diseases. Hypertension, you try to treat properly. Diabetes, you try to treat properly. Dyslipidemia. If you can manage this, so that much is fine. First of all, you should know when to treat, when to refer. That is a basic thing you need to understand when you do a private practice. If you know, you treat it. And if it is complicated, just refer it. That's it. Nothing to get stressed with that. Best job in medical college, but posts are saturated mostly. Growth is less in medical college. In private, growth is almost nil. Another option is clinical pharmacology. Yes, Abhidyak Dash, you are right. Clinical pharmacology, but there also you have to slog for another 3 years, and then you have to come back either to a pharma industry or a medical college. But medical college will be the same thing. Krishna Chandak, pathology has saturation, less earning, and no name or recognition. Now, recently one of my friend's sister, she finished MD pathology. She was in tier 2 city, and she is earning like anything. So more than any clinician, she runs a lab and she takes care of every investigations, and she works and she is earning a lot. So it doesn't mean that it gets saturated. See, no field gets saturated. You have to decide and then do your efforts. But only thing is, in the metro cities where already so many pathologists are there, so many consultants are there the competition is there. But you come to the towns, you will be the king. That's a simple basics. Will DM pharmacology help? If yes, how? Yes, DM pharmacology, it's only if you are going for a research field. DM pharmacology is only if you are going for clinical research. I told you, even with MD pharmacology, if you go for 3 years, you will have the same experience for that. So apart from that, spending time for DM clinical pharmacology, as per my advice, will not be worth. How is JSS Medical College for pharmacology? Yes, it's good. JSS Medical College in pharmacology will be good. Kannada is not a problem. Particularly if you are coming to Karnataka, yes, we speak all the languages in Karnataka, no problem. So don't worry, you can easily come to this. Yes, Abhik Das, you are right. DNB clinical and or MD non-clinical, which is better, Dr. Ruth? Now, as per my experience, I have seen, I can give that comment for you all. DNB clinical or MD non-clinical. Now, DNB clinical will be better if you are going to see the patients, and if you are, your heart tells that you want to be clinician, so whatever DNB you do that, but practice in a tier 2 or tier 3 cities. And in medical colleges, I mean, it will be like a lower level than MD. So if you are practicing privately, DNB is not an issue. You can do practice anywhere, you can excel like anything, not an issue. KS Hegde Medical College, Mangalore for PG in MD Pharmacology, that is also fine. So the college doesn't matter. The college doesn't matter much. Only thing is, what I prefer is, if you have government colleges, take that, because the stipend is good. Take the stipend, enjoy. Then why you want to go to a private colleges when you have very good stipends in medical colleges, that is government medical colleges? Prefer that. If you are not getting that, then go to private. Any private would be better. There is a stigma that B Pharma and M Pharma people will compete with the MD Pharmacology. See, everywhere everybody will compete with you. Okay, so everybody will compete with you. So how you excel is going to help. So you have to be your own. You should show your talents. You should come up. That is how you have to overcome the competition. So you competed with 1.5 lakhs of your own colleagues, and you excelled. The same thing. Whoever comes up, you should not be worried about them. Yes, Krishna Chandran, can we do general OPD after path? Absolutely fine, no problem. You can do OPD, patient will come, refer to your own clinic, they will come to the same lab, no problem. So simple. If you are trying to learn a clinic, my advice is, don't have a practice under some medical fellow. That means a pharmacist. Better you start your own clinic, your own pharmacy, your own lab. So that is how you can practice. Otherwise, only for consultation you take 100, 200, 300 rupees, that will not matter. So you have to start your own pharmacy, start your own lab. That is the one best thing when you start practice. MD pharmacologists to leave to abroad. See, MD pharmacology as such is not valid in other countries if you do MD pharmacology in India. So only thing is, you have to do another exams there, then only it is, they will be considering your experience, not as an MD, but your 3-year experience as MD pharmacologist, that's it. Sir, in medical college, do they take people as faculty only who have done MD pharmacology? No, it's not like that. So they will not take only from medical colleges, from government, not like that. Anybody can join. How much salary in government job, Krishna? Yes, very good. Now government, for example, in assistant professor job, it's around 1.5K in a medical college, and for associate it's around 2 lakh, and for assistant professor 1.5 lakh, and for professor it's around 2.8 lakhs. If you are in a central government, it's still high. So one of my friend who took MD forensic medicine, he is now associate professor. He is more than 2 lakhs he is earning. So it all depends on which college you end up with. What options are there after doing MD from other than teaching? So Shiva Sharma, just now I completed that. So after that, that's what you can do: coaching, you can do private practice, you can come to research field, you can go with the pharma industry. I explained that. You can go before this video, you can start from the beginning, and you will see that. What are your views about MD anesthesia? My views about MD anesthesia, what I have seen is, their jobs are still open. The jobs are still open. You can be anywhere. Starting it will have a struggle, but later you will, when you get a contacts in the metro cities, you will be called everywhere. Even if you are not working in a metro city, if you are going out in a town, so you'll be king. Everybody will be calling you. That's not a problem for MD anesthesia. How can we get into government hospital as teacher? Now, particularly, there will be interviews. When you want to get into a government job as a teacher, there will be an interview. You have to pass this interview, and there is not a written exam, it's an interview. So that by that method only you can get selected. Yeah, Habib Das, yes, you are right. So it depends on colleges. So many colleges don't have that pension and PF also, and you are lucky to get that. Satvik Raj, that's not true. So all of the actually if you want to ask my personal opinion, I never wanted to be a doctor and I became that. I never wanted to be a teacher. I became a teacher. So when I started teaching, I started from my after I finished my MBBS, I worked as an junior resident in ENTs, and I started teaching that. Then I understood that I can teach better. So like that, it started. The journey started, and then when I joined medical colleges, I started improving myself, and that's how the journeys will start. Yes, Ajuma, nice meeting you. What is the scope for medical affairs, Lakshmikant? Yes, the scope for medical affairs, that is medical marketing, is still open. Every week or every month, we get so many jobs there. So I get so many queries if there is any MD fresh candidates we are hiring. And recently, I told you one of my junior, she got selected with a package of 15 lakh per month. I mean, 15 lakh per year, 15 lakh per year. So there is a huge scope for that. Yes, Krishna Chadak, thank you. How about job security in pharma industry? Will they fire according to the performance? Now, don't worry, there are so many pharma companies which are waiting for an MD doctor. So even if they fire, you have another company which will hire you. Don't worry, that is there. Okay, so I hope any other queries, scope and salary. I think I have told you that. With this, sir, now NMC approved MSc Medical College, pharmacology people to become faculty in medical college. I think they have not approved till now. It's still going on. Let us see. Main things to do as a resident. Now, whatever branch you take, whether you take pharmacology or any clinical branch, focus on the learning process and then do more research. Now, the one thing which the world recognizes is the research, what you have done as a research. Whether you have done any MD or something like that, if you want to be at the top and the world recognizes research, so do research. More and more papers you publish, if you publish more and more papers, it is also useful when you apply for abroad jobs. If you apply for any government jobs, they will ask for how much publication you have done and how much you have presented your papers in the conferences. So my suggestion is, apart, if you are a clinical, you are seeing the patient, that is one part, but along with that, do more and more research. It's a simple, you see the same cases, note it down, do the research, present that in a conference, and if you present the same thing and do a publication of paper, that will give more and more weightage, and the chances of selecting in an interview is so high. What is your advice to people who about to join pharmac residency? What books to start from, sir? Which books you recommend? Now, if you are planning to join MD pharmacology, I recommend you to start with there is something called KK Sharma. That's a very good book, and even KD Tripathi is a very good book. Only thing is he has given so much of information in haphazard manner, but otherwise the book is very good. So you can go with that KK Sharma. That is very good. And then as the days go on, you will understand what books to read. Because if I tell it now, you will not understand their importance. So yes. Yeah, AB, that's what I told you. In pharmacology, remember, you will have 3 years of time. I don't think you require 3 years of time to clear MD pharmacology. 1 year is fine, but they have made the course 3 years, as per my personal opinion. So what I suggest you is do more research, publish more and more papers. So 10, 12 papers in a standard journal, present in conferences, and you will be chosen you will be chosen compared to others. So that is the only suggestion I want to give you. Okay, so write research, do research. That is the only thing that is going to help you. Yes, a big dash. Yes, I agree with you. Yes, Krishna, thank you. Thank you to know that it helped you. Okay, guys, any other queries? I'm happy to answer your queries. So, Satvik Raj, yes, you need to do research even after joining a medical college. I'm doing research also. And because here also for promotions, you have to do research, you have to do publication, then only you'll be promoted further. Yes. Krishna, I can give my opinion. DNA secretary, yes, that is also fine. You can take up the DNB secretary. But yes, whatever you take up, how you excel in that field is very, very important. Now, only the MD matters. Please remember this, guys. MD, any clinical branch matters when you join a medical college only. Otherwise, DNB, yes. If you are doing private practice, you want to join a private hospital. No, no. There is no difference between MD and DNB. So keep that in mind. Yes, Himanshu, MD Pharma plus MRCP. Yes, you can have that equivalent of MD medicine. MD Pharma plus MBA scope AB is that it will be useful if you are joining a company, pharma company where you are planning for medico marketing. That means in a medico marketing, you have to come up with a plan, which drug you will launch, which drug will work out. And so all those things, you have to plan a marketing strategy for that. For that, MBA will help. Raunak Dingra, I couldn't get your question. Yeah, Satvik, that's what I started a book, but still in between, I will come back with the books soon. I'll check Raunak question. Okay, Raunak Dingra, can you post your question again? I'm not getting that. Scope for orthopedics, yes, still there. Scope for orthopedics. See, that's what I am telling you. Anything, particularly in the major metro cities, we have consultants because the consultants are there from last 10 years, 20 years, 30 years. So when you are in a metro city, you have to compete with them. But whatever clinical branch you take, come to the town, tier 2, tier 3 cities where you will be like a king, you will have recognition. But when you do it in a metro cities, it takes so much of time to get recognition. So whatever branches, whether it is ortho or whatever, so you after finishing come to the towns, smaller cities, and you will have very good name and you will get a recognition. But when you do it in that in come to the metro cities, you will be like in so many people you will be one. You will not have any recognition. That's one. Why students are reluctant to take pharma as severe as they desire to pursue patho? Now, it depends on personal choices. I don't know why students are reluctant to take pharma. I didn't find any such con in pharma, sir. But why? See, it depends on what you are going to do that. So pathology, it's one is teaching, and along with that, you have to attach to a medical college. There will be a lab. So a pathologist has to, in a medical college, has to take classes, and also he has to look into the lab. But pharmacology, you will have only medical college, only to take class, and most of the times you will have free time. You will have free time, but you have to utilize that properly. That's the only thing. What's the scope of this unique dual degree? Any benefit in USMLE? Raunak, what is that dual degree you are talking about? What is that? Dual degree. Raunak, I will be answering you, but what do you mean by that dual degree? Rabi, I'm not the expert in telling that which is best for general surgery. So we'll have a special session for that, and they will be guiding you for general surgery. So Milad, the same thing here, because I can tell you in Karnataka, but the other states I am not aware of which is better in surgery or ortho, so I cannot comment to that. Raunak Dhingra, biotechnology. See, biotechnology, and that doesn't have any extra edge in USMLE. Okay, so MD Pharma and biotechnology doesn't have anything extra edge in USMLE. USMLE, they don't count it as MD pharmacology, they will count you as MBBS only. So with that, you have to go for USMLE exams. So what will be the duty that MD Pharma has to do once he enters into the industry? Now, once he enters into the industry, the main thing is there is something called key opinion leaders. That means he has to take care of the consultants. He has to consult them what drug molecule is in the market, which is going to be better and how it can be made better. Then he has to look out for the drug advertisement, how to any default in that, and drug literatures, promotional literatures, what the medical representative comes and gives to us, whether everything is fine or not. And in between, he has to arrange for the meeting with the consultants. Then he has to take their opinions and arrange for CMAs, conferences. So he has to travel to so many conferences and see what's trending in the conferences. That's why lots of traveling occurs here. And he also has to train the medical representatives. So these are the roles that we have in case of medical marketing. My final view on KS Sigday and Empire, both are good. So it's if you have my thing is if you have a government college, go for that. If that is not available, you can go with a private college. Both KS Sigday and Empire are good, no issues. So what will change after national exist test is applied? The one thing which is going to change is the students will learn in internship. The students will learn in the internship. What happens now is after the MBBS, when they pass their final year, most of them will be into the coaching. They don't learn most of the basic skills, and they are going to jump into the coaching. So that's why the purpose of keeping this next exam and making the curriculum uniform throughout India is to make a skillful doctor. We call it as Indian medical graduate who is skillful. So that is the only thing which will change, otherwise everything keeps the same. Satvik Raj, obviously I will take pharma in BMC only. So both are good. Yes, I would take BMC, pharma only. SEMA scope for DGO. So DGO, no worry. If you are in a town, obviously you will get so many patients because there are so many deliveries occur, cesareans occur, sections occurs, then hysterectomy occur, and it's a matter of 1 year, 2 years. And after that, you will be so much busy, you don't have time also. So particularly if you are a DGO, practice in a town, and that will be better for you. Okay, so I'll be there for another 3 minutes. Any queries, I'm happy to take up, guys, and then I will end up my session. Thank you all. Yes, Deepak Gupta, good evening. Nice to see you. Uh, Raunak Dingra, that's what, there is nothing special if you have finished biotech engineering MBBS from Manipal. The only thing is, in a pharma company, not only drugs, there will be something called devices, medical devices. There it will be helpful, but not for USMLE. It is not going to do much. Do one has to sacrifice family life in the initial stages into industry? Yes, because there will be a lot of traveling to occur. Now, it's not only in pharmacology, whether you take a clinical branch also, if you are night duty, if you are from morning to evening duties, there also you have to sacrifice the family life. It's not like only here. And after that, you will come to realize, and then you will have preferences, what to do, what not to do. Yes, Satvik Raj. Yes, my batchmates have joined because as a government faculty, you know that if you want to get chosen for a government job, it all depends on not only your merit, it also depends on the reservation and all. So based on that, you can also get selected. Not only the interview, but all these things also matter when you enter a government colleges. So not your merit. So along with that, the reservations. So all these things matters for you. Yes, Abhik does. That's the point. Towns are the best one. Rami, can we apply next exam to super special entrance exam? That is not still clear. So once you clear this next exam, that is mainly for the MD. Only I think in the AIMS you can directly take up the DM courses. Only in case of central institutes. Yes, vacancies in pharmacovigilance are there. So I told you recently one of my junior joined with a package of 15 lakh per month. Okay, guys, that's it for today, and thank you for interacting with you all. And hope any queries I will be answering those queries in the YouTube section only. And thank you all. So please remember, whatever branches you take, always have pros and cons. Try to excel in whatever you do, right? And there is a saying that when you make a decision, make that decision right. There is nothing like right decisions. So when you take a decision, make that decision right. So that is what you have to do. Okay. So every field has a pros and cons. How you take up that and how you excel in that field all matters. Thank you all. All the best. Please choose your branches and excel in that. Thank you all. Take care. Good night.